Top 10 Early Warning Signs of Prostate Cancer. Prostate cancer is a serious health concern that affects men of all ages. But the good news is that it can often be detected early with the right knowledge and awareness. Are you curious about the top 10 early warning signs of prostate cancer? Whether you're a man concerned about your health or a loved one wanting to learn more, this informative video will equip you with the knowledge you need to recognize the early warning signs and take action. From subtle changes in urination to unexpected pain or discomfort, discover the top 10 early warning signs of prostate cancer and take the first step towards early detection and treatment. Prostate cancer is one of the most common types of cancer in men, with over 248,530 new cases expected to be diagnosed in 2021 alone in the United States. Although the disease can be deadly if not detected and treated early, the good news is that prostate cancer has a high survival rate when caught in its early stages. This is why it's essential to be aware of the top 10 early warning signs of prostate cancer, which may include frequent urination, difficulty starting or stopping urination, blood in the urine, and pain during ejaculation, among others. By recognizing these symptoms, men can take prompt action and get the necessary medical attention to help detect and treat prostate cancer early, improving their chances of recovery and survival. So let's delve into the top 10 early warning signs of prostate cancer and what you should do if you experience any of them. Trouble urinating. Problems urination may be brought on by prostate cancer, the course of prostate cancer therapy, or an entirely different factor. Your urethra is the tube that transports urine from your bladder outside of your body. The prostate gland is where the urethra enters. You might struggle to urinate if a prostate tumor is big enough to compress the urethra. Incomplete bladder emptying, difficulty starting to urinate, an increased need or regularity, pain, or a weak urine stream are all examples of urinary issues. Once the cancer is removed in this case, the urinary symptoms will usually go away. The condition known as benign prostatic hyperplasia, BPH, which causes the prostate gland to enlarge, but is not cancerous, may also be the source of the same urinary complaints. Prostate enlargement caused by BPH is typically accepted as a normal component of the aging process for men. The majority of urinary complaints usually go away when BPH is treated. Blood in the urine. Hematuria, also known as blood in the urine, can be caused by a variety of conditions, many of which are not serious or life-threatening. But since prostate cancer typically manifests in advanced phases of the illness, it should not be disregarded. Men may notice their pee is pink, red, brownish red, or tea-colored, rather than the urine's typical pale yellow hue. The presence of red blood cells in urine can occasionally be discovered in a laboratory, even though it may not be visible to the naked eye. Bone pain. When prostate cancer moves to the bone, it may hurt and slash or weaken the bone. However, not all males with bone cancer will experience bone pain. Prostate cancer has the potential to expand to any bone in the body. Usually, it spreads to the vertebrae. It can occasionally be painful to walk and move around due to pain in these regions. Even though the pain may initially only be in one location, it may eventually extend to other areas of your body. When prostate cancer moves to the bone, it may hurt and slash or weaken the bone. However, not all males with bone cancer will experience bone pain. Prostate cancer has the potential to expand to any bone in the body. Usually, it spreads to the vertebrae. It can occasionally be painful to walk and move around due to pain in these regions. Even though the pain may initially only be in one location, it may eventually extend to other areas of your body. Losing weight without trying. Unexpected weight loss is frequently the first observable sign of malignancies of the esophagus, pancreatic, stomach, and lung, according to the American Cancer Society. When a tumor becomes large enough to push on the stomach, other diseases, such ovarian cancer, are more likely to result in weight loss. You might feel fuller more quickly as a result. Some cancers can also manifest symptoms that make eating challenging. Inflammation is also exacerbated by cancer. Your body's immune reaction to a tumor includes inflammation, which creates pro-inflammatory cytokines and changes your metabolism. The hormones that control your appetite are disturbed by this. Moreover, it encourages the breakdown of muscle and fat. Your body expends a lot of energy fighting a growing tumor, which could lead to an increase in resting energy expenditure, REE. Your body burns REE when it is at rest. The two terms are frequently mixed up. Everyone occasionally feels worn out. It's a sensation you anticipate at the end of the day or after particular actions. Typically, you are aware of the cause of your fatigue, and a restful night's sleep takes care of it. A lack of energy during the day is fatigue. Unusual or extreme body fatigue that is not alleviated by sleep is what it is. It may just last a month or less, or it may persist for a longer period of time, 1 to 6 months or longer. You may be unable to carry out daily tasks due to fatigue, which also interferes with enjoyable or necessary activities. One of the most frequent adverse effects of cancer in treatment is weariness. By tumor kind, therapy, or stage of illness, it is unpredictable. The majority of the time, it strikes unexpectedly, is unrelated to activity or exertion, and is not abated by rest or sleep. Even after treatment is over, it can persist. Change in bowel habits. It can be challenging to anticipate bowel issues caused by prostate cancer or the therapy for it. On rare occasions, a prostate tumor may enlarge and begin pressing on nearby pelvic structures, leading to bowel-related problems. These problems may also be a symptom of advanced prostate cancer that has spread to the spine. Cancerous tumors in this case have the potential to obliterate the spinal bones and disrupt or harm the spinal cord nerves that regulate bowel function. Another way that these symptoms could manifest is as a result of the radiation therapy, surgery, or chemotherapy used to treat prostate cancer. Discomfort or pain when sitting. Urinary incontinence and inexplicable pain in the vicinity of the prostate while sitting are two other potential early indicators of prostate cancer. Men may have lower body swelling, back, hip, or bone discomfort, irregular bowel or urine habits, or unexplained weight loss if the cancer has gone beyond the prostate gland. It is significant to remember that many other, less severe illnesses also exhibit the same symptoms as prostate cancer. Even if you have one or more of these signs, you may not actually have prostate cancer. Similar to this, a guy with prostate cancer might not experience any of these signs and symptoms. Swelling or fluid buildup in the legs or feet. If you see any swelling, let your medical staff know. Your doctor or nurse will identify the source of your problems, give you advice on what to do, and maybe prescribe medication. Edema-related issues can sometimes be very serious. If you have shortness of breath, have a heartbeat that seems irregular or out of the ordinary, experience abrupt swelling, or swelling that worsens or moves up your arms or legs, gain weight quickly, or urinate seldom or not at all, call your doctor or nurse. Frequent urination. The term flu-like syndrome refers to a collection of linked side effects that can result from cancer therapies, like chemotherapy and immunotherapy. If your flu-like symptoms are severe, you might be urged to consult a doctor right away.